Hi, I'm Andrew Denton, a DNP student at Franklin University, talking today about hospital-acquired pressure injury prevention project. Hospital-acquired pressure injuries are a significant issue facing America's healthcare system. Each year, 2.5 million patients develop a pressure injury in the United States, costing anywhere from 9.6 to $11.6 billion. Pressure injuries negatively impact patients by increasing the length of stay, cost of care, workload, and doubling the patient's risk of death. The electronic medical record is used to collect pertinent data in this system. The analytic team lead provided the happy occurrence rate of 2.3 per 1,000 patient days. The second system, an iCare system, a self-reporting associate-driven patient safety concern system that allows every member of the team to have an equal voice to report patient safety concerns. And the project advisor acknowledges there have been 4 occurrences of patients being found wet and soiled when transferred from the emergency department. After a evidence-based practice literature review, the team proposed a happy bundle intervention. The first part was a dual nurse Braden scale admission and daily reassessment. Calhola used the Braden scale assessment to determine at-risk patients. Jackson et al. Actually used Braden scale assessment and subscales to determine individualized patient-centered care interventions. The second part of the happy bundle would be intentional rounding. Intentionally rounding on your patients every hour to determine their safety. Cajola rounded on patients every 2 hours to ensure linens were smooth, skin was clean and dry, foreign objects were removed from linens, and medical equipment and patients were repositioned. Onan and Dugu changed patient positioning, monitored medical devices, assessed the skin and patted it, and applied preventative cream every 2 hours. The last piece of our happy bundle intervention will be a prophylactic sacral pad. Calhola used a sacral pad to reduce shear and friction to prevent happy occurrences. Uchua conducted a systematic review and meta-analysis of randomized controlled trials that showed the use of foam sacral dressings in the ICU significantly improved patient sacral injury occurrences, patient pain during changes, and peri-wound maceration. The interprofessional team developed SMART goals and aims. The first SMART goal was within 2 weeks of implementation, 100% of patients will have a dual nurse skin and Braden scale assessment documented within 8 hours of admission. After 2 weeks of implementation, there will be 0 iCare occurrences of patients found soiled or wet when transferred from another unit. And the project aim is at 3 months of initiating the project, the hospital-associated pressure injury occurrence rate will be 50% less than 2.3 per 1,000 patient day. The Plan, Do, Study, Act model will be used for this project. Ogrenik shares that the PDSA model is a plan to do the intervention, doing the intervention, studying the data from that intervention, and creating an action about moving forward. It allows stakeholders to quickly identify what actions lead to quality outcomes. The PDSA project implementation will be done by an interprofessional team consisting of a student project leader, the assistant nurse manager, project advisor, unit physician, analytic team lead, and bedside staff. In the planning phase, the team will review fishbone diagrams, process maps, and current evidence-based practices to determine clear roles and interventions to combat the happy rates. Then we will do the implementation phase and study it by collecting data in the iCare and Happy EMR systems and present that data to pertinent stakeholders. Next, the interprofessional team will act upon that data and move forward. The team's primary measurement outcome will be the hospital-acquired pressure injury occurrence rate with a goal of 50% reduction happy occurrences from 2.3 per 1,000 patient days. Secondary measurements will be the iCare happy related incidences and associate satisfaction through surveys. Here is a list of references, and thank you for watching.